Well, I accepted the health portfolio at the Assembly of First Nations because in the Ontario region alone, we've seen increased rates of serious mental health, suicides, diabetes, cancer, a lot of funding cuts. We certainly have issues that we need to bring to the forefront politically. And we also need to get support behind those people that are on the front line and those that are responsible for evolving health authorities in our regions. So again, it was an obvious one. I'm ready for the hard work. There's been a lot of hard work done by our people, so it's time that we collaborate. Well, the mandate obviously is to build on the success, like the First Nation Health Managers Association, for example, and the good work that they've been doing. Listen, we don't need to recreate the wheel. What we need to do is we need to build on success. We need to find out and troubleshoot where the issues are, and we need to build from there. But I think that the overall mandate is one of collaboration, coordination, and cooperating with one another as it pertains to, you know, the child with mental health issues or the person that's dealing with chronic diabetes. You know, it really is to collaborate, and at the AFN level as the health portfolio holder, my job will be to work with the chiefs across the country and to bring this all together. Well, my message here today is you're not alone. I think what we've seen here in the last decade under a Conservative government is we have been alone. We've been facing fierce funding cuts from the former federal government, and you know, we've had to deal with that, and our people have been left alone and in many cases rendered helpless to be able to address health issues and concerns at the community level. So my message is you're not alone. And for this association, I need to let you know that we are watching as leaders, and we do respect and appreciate the managers at the community level. And I think the work that's being done in the association is so vital now because the one missing component is a high level capacity and collaboration with all the health managers, so that way we can have a positive effect on evolving policy in this country, and we need our health managers. So the message is you're not alone. Well, the message is this. Listen, you know, earlier on in this campaign, I worked with Dr. Michael Dan, who is a philanthropist, and he is the founder of the Wabaga Bryce Institute at the University of Toronto. I worked with him, I worked with the leading physician of the Sick Kids Hospital, and I worked with Cindy Blackstock, and what we did was we put out a call to action. And what we said was that there's a First Nation health crisis in this country, and that it's not only the responsibility of governments and First Nation leaders, but it's the responsibility of all Canadians to understand what this issue is. So, you know, I want to let the Prime Minister know that I very much appreciate the gestures of collaboration that he has put forward and the willingness to help. In saying that, we want the new federal Minister of Health, we want the Minister of Aboriginal Affairs and other line ministers to recognize the work that needs to be done and include us. You know, let's actually work on what nation to nation means in terms of those determinants of a healthy community. We need to do that work together. I think, you know, we have an opportunity as First Nations, as Canadians, as governments, as jurisdictions right across this country. We have an opportunity to make wholesale change in terms of a national identity. You know, we're doing this work on the heels of the TRC's efforts and recommendations from Justice Sinclair and the commissioners. You know, we've went through the process of a royal commission. There's been studies, there's been a lot of work done to date. We know what needs to be done. What we need now is we need real investment, we need commitment, and we need follow through. And I really acknowledge and recognize what's happening at this association meeting of health managers for First Nations. And again, let's support these people in the work that they do.